I love the atmosphere. NightLight is a very family kind of oriented atmosphere, and we hold each other to really high quality and standards, and we're very cooperative, and it's a great fun place to work at.
You kind of play off of you notice what they like they're in the cars room, like you point out all the cars, you look at the butterflies, you look at the colors, and just kind of go with the flow. That's how you are in pediatrics, and so that's what I like about it, and then that's how we have fun, and it's colorful. And the stars.
We have glow-in-the-dark stars.
glow-in-the-dark stars everywhere.
Our treasure box for when we do procedures. They get to pick a little toy at the end, so things like that. It's focused for children, so our facilities are designed and have amenities that kids that are geared for kids, and so that's one thing. The pace at NightLight is about equal to any other clinic. We start on weekdays at 3 and end at 11, and we're seeing we spend about 15 minutes per patient is our goal. And it's a pretty steady pace depending on the location. Some places are busier than others, but we definitely feel like we have time to give each patient enough attention to answer questions and their needs.
I think the pace is quick but efficient, I would say. At most of the clinics it's pretty constant, but we're not overwhelmed.
So nurse practitioners and us pediatricians work side by side. We divide up the patients about taking turns. A lot of them do procedures as well, and so the work is divided up pretty equally. Mm-hmm. And again, a lot of they have great experience. It's always been a joy to work with them. Our MAs are excellent. They're some of the best MAs I've ever worked with. They know what they're doing. They take the extra step with our patients as well, and they're so skilled that our patients, when we come in, already have that level of comfort being here. So that helps a lot.
Yeah. I'm really friends with all the other staff. With the nurse practitioners, some of them have more experience than I do. I just got out of residency a year and a half ago, and some nurse practitioners have been practitioners for decades. And so I consult them, and we work really close together. And then also with the MAs, we need them and they need, we work together very closely, and everything is good, and we're friends outside of work too. The MAs are so well trained that they do stuff before I even ask, and they know exactly what to do, and it's amazing. Everything is ready, and they know kind of different practitioners' styles and what they like on their tray and all this stuff, and I'm really always amazed at how well that. I don't know.
So you put your orders in, and then you kind of verbally just tell them, and if it's a wound wash, they're already in there. They know the procedures. Like you said, when you're doing a wound care sutures, they have the tray set up for you already, and so you don't have to micromanage very much. If there's something you do want to, though, they're very receptive, and
I think they work well. They work well together. So if we have a full house and we're making orders and there's 80 things to get done, they talk to each other, and everything magically gets done because they have good communication.
Yeah.
And we talk to them too. We're all on the same team. We're here for the same purpose.
And no matter what you tell them, they always they say, "Sure, no problem," and with a smile. It's always been helpful.
Yeah.
Even
of course, that's
no, yeah.